It starts with a whisper, a dull, annoying ache right around your belly button. You ate something weird, probably, or maybe you just slept wrong. It's easy to dismiss, because who runs to the doctor for a simple stomachache? Unlike the sharp burn of an ulcer or the churning waves of food poisoning, this pain is vague, almost forgettable. But inside, a clock has started ticking. Your appendix, a small pouch attached to your large intestine, is becoming inflamed, and you have, on average, between 48 and 72 hours before it becomes a life-threatening emergency. The first real clue that this isn't just bad takeout is the journey. Over the next few hours, the pain doesn't stay put. It migrates. It packs its bags and moves into the lower right corner of your abdomen. And when it settles there, it's a different kind of pain. It's no longer a dull ache. It's sharp, constant, and specific. You can point to the exact spot.
Now, every movement is an agony. A cough, a sneeze, a deep breath, they all send a jolt of white-hot pain through you. At the same time, your body sends out other signals. The thought of food becomes repulsive. You feel nauseous. Maybe you even vomit. A low-grade fever begins to creep in, a sign your body is trying to fight an infection that's getting worse by the minute. This is the critical window. Without treatment, the risk of your appendix bursting starts to climb dramatically after about 36 hours. At that point, there's a 2% chance of rupture, and that risk increases by about 5% every 12 hours after that. Inside some people, there's an extra risk factor, a tiny calcified deposit called an appendicolith. Think of it as a small stone blocking the appendix. If you have one, your risk of a rupture is significantly higher, and non-surgical treatments, like antibiotics, are far less likely to work. A burst appendix isn't a dramatic explosion. Instead, the wall of the organ gives way, leaking infected material into your abdominal cavity. Some people report a sudden, fleeting sense of relief as the pressure is released, but it's a trick.
It's followed by an overwhelming, widespread agony as a severe infection called peritonitis takes hold. This is when the situation becomes deadly serious. So, how do you know? You listen for the story your body is telling. It's not just one symptom, it's the sequence. The vague pain that travels and transforms into a sharp, localized threat. The loss of appetite, the nausea, the fever that builds alongside it. In a hospital, doctors don't guess. Advanced imaging like CT scans and ultrasounds can now diagnose appendicitis with incredible accuracy, far beyond the old methods of just physical examination. The treatment is typically a straightforward laparoscopic surgery to remove the inflamed organ. While research continues into antibiotic-only treatments for simple cases, surgery remains the definitive way to prevent a rupture. That initial, ignorable ache is a warning. The journey of the pain is the alarm. Don't wait to see how the story ends. Trust the signals your body is sending you, because this is one time where being wrong is infinitely better than waiting until you're right.